Discussing compensation is one part of my term, is to actually get a foothold, get a foundation of what's actually being addressed from there, and also develop multiple layers in terms of the understanding of the cost of care of these patients, which is often overlooked from just the cost of drug reimbursement, but the overall cost of care. With ACCC, we want to look and provide further support and understanding on these measures as well. Another piece that we're going to be looking at is the innovation part of my theme for presidency. Innovation is currently an ongoing strategic goal across everything in cancer care, but it's also healthcare, right? We're looking at new models, new techniques, new electronic devices. So looking at understanding about innovation, addressing innovation, will actually be looking at several different pieces. The first piece, which will be a major discussion point, will be biosimilar development. We have biosimilars in the oncology scenario and also non-oncology scenario. New and emerging biosimilars are hitting the market shortly, as well as therapies which are actually going to be competing in that market too. Looking at biosimilars to reduce drug costs, to maximize patient access, is one of the key points of the innovation. In fact, sometimes people may say innovation or imitation leads to innovation as well. In this case, biosimilars fit that bill. So helping ACCC members understand biosimilars, actually educating members about biosimilar implementation, and not just the actual prescriber side, but everything down the road, including pharmacists, nurses, nurse navigators, and also our financial team, because everyone's involved in actually getting the drug to the patient, will actually help continue patients on therapy, but also maximize access for patients on treatment as well. And that's just one of the key pieces for understanding innovation. Other areas which we'll actually be looking at for ACCC is next generation sequencing, which is a major determinant for a lot of new therapies. We're looking at targeted therapies, speak of the devil there, in regards to these new treatments coming out. But a lot of these treatments are actually requiring biomarkers or mutation testing. So one of the goals is to help educate our members on this. We actually have a pathologist on our board of trustees this year. It's the first time we actually had one, and it's going to be actually imparting a lot of the information and also new techniques to help understand what's happening with targeted therapies on the cancer care delivery team.